Hello, it's Dr. Rhonda Johnson. Today is Monday, June 6, 2022, and today I'm discussing where to get factual and reliable information about COVID. While some of the comments that people have shared on my social media sites are basically to the effect that their local news outlets, both TV and written, offer little to no coverage on the current COVID pandemic anymore. Now, I'm not surprised because, after all, local commercial networks and newspapers, they have to raise revenues through advertisements, and they compete with each other for ratings. We all know that talking about COVID is not popular. People are done with this pandemic and they really believe it's over. So I thought I would share some of my go-to websites and free sources of information that I use for COVID. There's a lot of information out there online and through social media, but you have to be careful because there's a lot of misinformation out there also. So I'll start with the New York Times coronavirus in the United States. Now that has global and domestic data. They have narratives and articles, including frequently asked questions. Another site I go to is the Johns Hopkins Coronavirus Resource Center. One thing I really like about this site is that they have frequent webcasts with experts, and they're easy to understand, and they are not sensational. Another site is the CDC website. I also read their weekly morbidity and mortality journal, which is more for professionals. But they keep the COVID information up to date, and it's written at a third or fourth grade reading level, so it's very easy to understand. Now, your state and your local health departments may or not be good sources of COVID information. Not all health departments are equal, and some may just not have the staff or the funding to be up to date. Another great source of information are academic medical institutions and universities. Many have great information about COVID, and it's local, and sometimes you get community-specific data. So these can be great sources of information also. Now, public broadcasting sites such as NPR often have excellent COVID information that is current, and multidisciplinary science journals. I'm partial to Nature. I just love their content. They have leading experts from around the world. Now, of course, I read all the medical journals, a lot of the medical newsletters, and preprint publications for information also. Now, I do want to say, full disclosure, I don't have any financial ties to any of these sources. I use their content as a member of the public. So I hope this is helpful as resources for factual and reliable information about COVID. COVID hasn't gone away, and we are on our own in terms of prevention. Remember, wearing a high-quality mask can help you from infection in public settings. You want to optimize your ventilation whenever you can, and always vaccination and boosters lower your risk of dying. This is a potentially deadly and potentially disabling disease that has not gone away. That's my message today. Take care. Be safe.